Good afternoon, everyone. Sorry, we had some technical issue. Now everything should go smoothly. So welcome to the webinar Shaping Climate Resilient Healthcare in Europe through Policy and Practice. Thanks once again for joining us today. We hope that you will enjoy the event in any way. And we got actually a fantastic panel of speakers for you. And so while we start, I think already people start sharing where they are joining us from. That's great. And keep on connecting throughout the event. My name is Gabriella Abruzzo, and I am the Climate Project Officer at Healthcare Without Harm Europe. And today I will present during the first part of the event in which I will share the final result of the Life Resistal project in a form of a roadmap to show how the resources and tools developed by the technical partners of the project can support and guide healthcare organizations to become more resilient to the impact of climate change. The second part of the event is a policy discussion. Discussion will be moderated by Diana Picon-Magnari, the International Climate Senior Director of Healthcare Without Harm, and together with her there will be an incredible speakers lineup. And during this session, we will highlight how policy and policy changes are essential to strengthen healthcare and community climate resilience, and how policy can serve as an engine for practice and innovation. In this critical moment, practice and policies have to go hand in hand, reinforcing each other to create a more resilient community. Before we start with the presentation, a bit of housekeeping. The webinar is being recorded for further dissemination, and the recording will be shared on our YouTube channel. You're welcome to share your thoughts and questions in the chat, and indicate to whom your question is directed, and we will address them during the dedicated Q&A. Now we can start with the webinar, and as we know, climate change is the greatest public health threat of the 21st century. Europe is warming faster than any other continent, and 2024 Europe experienced its hottest year on record, with more days of dangerous heat and warm nights than any other year before. Western Europe also faced its most widespread flooding in over a decade. And here is where extreme weather events like this put pressure on healthcare facilities just when people need them the most. Floods, storms, and heat waves can damage hospital buildings, disrupt electricity and water supplies, and block access to care. They bring new health risk, from heat-related illnesses to the spread of infectious diseases. That's where the Life Resistal project comes in. Since 2021, Life Resistal has developed and pioneered the first comprehensive framework for climate resilience in European healthcare facilities. It offers practical tools and guidance to help hospital and other healthcare service building climate resilience and be prepared for impacts of climate change. In today's presentation, the project will be presented, as I said, in a form of a roadmap. The roadmap is divided in 7 steps and combines the 2 main components of the project: the upscaling adaptation static package and the toolbox. So you can see on the left side of the screen, or maybe on the right side of the screen, the upscaling adaptation static package that contains all the open access resources of the project, so the best practice, the recommendation, and the guides, and contains also the toolbox. The toolbox that is divided in 8 modules is designed to help healthcare facilities understand, prepare for, and adapt to the impact of climate change. The modules are interconnected among each other, working together as a single powerful resource, guiding hospital from the first risk assessment through the development of an adaptation plan. So the first step is preparatory work. In this first step, healthcare organization will start by understanding what it means for the healthcare sector to be or to become climate resilient. For this goal, the practical guide for building climate resilient health systems comes in handy. The practical guide defines key components related to climate resilience and explain how climate change affects the healthcare service. It outlines essential steps and actions to strengthen climate resilience. In this first step, we also find the establishment of a community of practice, a network of external and internal stakeholders that can support since the early stages of the path towards climate resilience, healthcare facilities in strengthening its climate resilience capacity, thanks to their expertise and experience. The Libura project has developed a community approach replication guide, a methodology for healthcare organization to establish a community of practice. You can see on the screen an example of a timeline and activities where the community of practice can be involved. And involvement of stakeholders is essential as well for the next steps of the roadmap, as they can support healthcare facility in the use of the Libura toolbox, gathering necessary data and information. So in the second step, you will start using the Libura toolbox. In the various slides, you can see what the toolbox looks like in its various modules. So we start with the first 2-3 modules, and in this one, you will collect facility background information, use it in this module for in the module of infrastructure, asset and people, or IAP, to describe the facility you wish to perform the analysis on. You will also define the accepted level of risk, representing the degree of potential loss that an entity considers tolerable, the point where risk is low enough that it is preferable not to take further actions. The module of climate risk of climate hazard provides the climate information and the climate scenario that the analysis will be based on. The option, the option of 2 climate scenario, 3 time span for 3 climate-related hazard is provided. The information is then used for the risk and vulnerability analysis that we will find in the following step. So step 3, I have a focus on assessment. The first assessment is the capacity assessment. In this one, you will evaluate the level of capacity and training needs of your healthcare facilities. To support healthcare facility conducting the capacity assessment, Libura has published the capacity assessment metrics methodology. The metrics is a diagnostic tool identifying the resilience capacity gaps to face climate hazard within a healthcare facility. By answering a checklist, it will be possible to produce a resilience profile for any healthcare facility. Following, once you have selected the hazard and the time span scenario, you can perform the vulnerability assessment divided into impact assessment and risk assessment. The vulnerability assessment, as well as the impact and risk assessment, is divided into 4 categories: healthcare workforce, wash and healthcare waste, energy, infrastructure, and technology. These obviously are based on the WHO manuals. In the impact assessment, the tool provides a list of impacts under specific hazard, and the impacts themselves are categorized as medium, major, or low impact. In the risk assessment, climate information together with the impact itself is combined in the risk matrix. And the different part of the infrastructure have different level of risk. You can see on the screen an example of the risk matrix and the various division of low, medium, and high. This assessment will give an overview of the level of risk at your healthcare facility under a specific climate hazard. As well, Live Resistal has produced the guidelines to develop vulnerability risk assessment, which provides a definition of hazard, exposure, and vulnerability, a framework and a step-by-step guidance on how to conduct a vulnerability and risk assessment at your healthcare facility. The assessment will generate a report and will provide information regarding the areas at risk, areas of improvement, and recommendation. This information will need to be analyzed, and they will be essential for set adaptation objectives. That will be the basis of the development for adaptation pathways. They will be used as well for the estimation of the economic losses. That will estimate the economic losses of inaction versus action, and they will support, obviously, as well decision-making processes, and will be useful to evaluate adaptation solution, as the assessment will also provide a list of potential measures. Now, based on the selected adaptation measures, the tool will make a cost-benefit analysis of the identified adaptation measures. It will help you understand the financial feasibility of measures and allow you to compare the different available adaptation solutions. Decision-making it can be also supported by a guide, the Procuring for Adaptation, incorporating climate adaptation into healthcare investment decisions. The guide is intended to assist healthcare organizations in making investment and procurement decisions in a way which promotes the physical adaptation of their facilities and estates to potential harms driven by climate change. Step 6, now that you have explored and selected the appropriate adaptation measures, the development of an adaptation pathways map will help assess which solution need to be taken now and which in the future, in accordance to the adaptation objectives and the adopted vision for your healthcare facility. Multiple paths can be defined and different risks can be considered. The figure on the screen displays an example of adaptation pathways map. The Live Resistal also provides guidelines to develop adaptation pathways that lays out a methodology to develop and envision adaptation pathways relevant for healthcare facilities and health systems. By this point, you should have gathered all the necessary information to write a plan. The plan should include background information about the facility, the governance and structure of your community of practice, the result of the vulnerability risk assessment, your objective, priorities, and available funding. If you want to create a more holistic plan that aims to strengthen climate resilience, mitigation efforts should also be included in the plan. The plan should also include the monitoring and tracking system and indicators to evaluate the effectiveness of the measures, and also should adaptation criteria should also be integrated. The last step is crisis management. This step is a bit more independent than the others, and it can be allocated more flexibly throughout the roadmap. However, it's recommended that this model is used only once the community of practice has been established, as external stakeholders can be essential for a well use of this model. The toolbox offers a management tool to help healthcare facility coordinate healthcare professional availability, controlling the flow and allocation of mobilized staff, and maintaining adequate and effective healthcare delivery during extreme weather events. To conclude, Resistal provide resources, serve as a foundation for increasing healthcare climate resilience. However, we have to acknowledge that some gaps are always present both in the methodology of Resistal and in the roadmap, as the project is a pilot project, so has a quite restricted focus. That is infrastructure, so many aspects of healthcare delivery could not be addressed in the project, and also for not all climate hazards can be considered, but the one considered were the one more impactful for the pilot hospital of the project. As well, there's no focus on climate mitigation, while for climate resilience, mitigation is an essential aspect. As well, some of the resources of Resistal are currently transferred and further developed in the Montadab project that share with Resistal the same core objective, the one to increase the climate resilience of European healthcare infrastructures. And three models of the toolbox: the infrastructure, asset, people, climate hazard and vulnerability risk assessment, the COP methodology, and the practical guide for building climate resilience system have been transferred to the Montadab project. So, thank you for listening. And I wanted to remind you, I think, as you can already see in the chat, that all the links and the resources have been shared. As well, we will share all the links to all the resources in the post-email event. And now I will check if there is any question. I think we can invite on the, I will leave the floor to Diana Picon-Magnari, our International Climate Senior Director at Healthcare Without Harm Europe. Healthcare Without Harm, not Europe, sorry. Just used to say Europe. That will be the moderator for the policy discussion, the second part of the webinar. Hi, Diana. Thank you for being here.
Ciao, Gabriella. Now you want me to also join Healthcare Without Harm Europe? No problem. Always happy.
Yeah. So I think you're the perfect moderator for the next session. Sorry, I put pressure on you. But can you tell us a bit about yourself? Because I didn't just mention your job title, but there's more behind that. So where you're based and your expertise in the field of climate resilience.
Absolutely. No, thank you so much for inviting me. And it's my pleasure to be moderating this great panel. I'm usually based out of a small town called Tacoma Park in the state of Maryland, right outside of Washington, D.C. But this week I have the great pleasure of being part of an expert panel here at Heidelberg in Germany. And so I've been spending the time with a bunch of people who are very knowledgeable about climate resilience in the health sector as well. Really energizing a meeting here. At Healthcare Without Harm, I work in the global team. It's a team that provides technical assistance to ministries of health and health systems worldwide in measuring and designing mitigation and adaptation measures in the sector, while working also on advocacy and strengthening the commitments around decarbonization and climate resilience in the public sector, in the private sector at different levels. If you are a GGHH network member, you've probably seen some of our guides and our tools, and we work very closely with our teams in Europe, in Southeast Asia, and in Latin America, and the partners that we have, strategic partners worldwide, to really bring together the learnings from the actions taken worldwide to bring them up, both through WHO and the Alliance for Transformative Action on Climate and Health, but then also through the GGHH network and health professionals networks that we have helped manage during this time. And that's pretty much it. That's me in a nutshell. I've been working on climate decarbonization and resilience now for a few years. My background is in public health, mostly on infectious diseases, and then also for many years working on climate resilient food security in Africa and Southeast Asia, South Asia, and a bit on Latin America too. So more than that, or I hope that's enough. And over to you, Gabi.
That's really impressive. So congratulations, I must say first. But I look forward to hear the policy discussion that you will moderate, and I leave the floor to you.
Thank you. Thank you so much. And it's really great to be here with you today and with this great lineup of panelists. And I'll be introducing each one of them as they show up on the screen. Before we get started, though, I just wanted to remind everyone that we do have that chat function. It's a live chat function for attendees. So if you have any questions during the session, please put your question there. I'm going to try to be brief and ask the panelists also to be brief a little bit because we had those technical issues in the beginning. But do please feel free to put your questions there. And if we cannot get to them, we can definitely write up answers in the chat. So without further ado, first we have Maria Libura, who is the head of Medical Training and Simulation Center at the University of Warmia and Missouri in Austin. She is a founding member and vice president of the Polish Society for Medical Communication. For the past 15 years, she has been involved in the rare disease movement in Poland, serving as the chair of a patient organization and co-founder of Strength in Genes, a coalition of patients with rare diseases, primarily focused on improving healthcare delivery and care coordination. She has served as a member of the Committee for the National Plan on Rare Diseases at the Ministry of Health in 2016 to 2017, where she coordinated a task group on information, education, and research. Previously, she also held the position of head of the Interdisciplinary Studies Institute on Rare Diseases at Lazarki University. Welcome, Maria, and thank you for joining us today.
Thank you, and let me add that now I'm representing the Medical University of Gdańsk and the Department of Public Health there. So.
Amazing. Welcome. Next, we have Andrea Schmidt. Andrea is head of the Department of Climate Resilience and One Health at the Competence Center Climate and Health of the Austrian National Public Health Institute. She works at the interface of research, policy, and practice, currently focusing on topics such as climate resilience of health systems and climate-smart health workforce. She led the development of a national health adaptation plan for Austria in 2024. She's also a consultant and a technical expert for the World Health Organization on health information systems, long-term care, as well as in the WHO Alliance for Transformative Action on Climate and Health, or ATTACH. Welcome, Andrea. Very nice to see you here as well.
Thank you so much. Really pleasure to be here. Thank you.
And then we have Kim van Dalen, who is an environmental epidemiologist at the University of Cambridge, studying the role of environmental and climatic factors on human health. She co-led the Lancet Countdown in Europe as lead author for 4 years, and she's currently an advisor to the collaboration. Welcome, Kim.
Thanks so much. It's a pleasure to be here.
And finally, last but not least, for sure, Mareike Kroll. Dr. Mareike Kroll is a public health expert with over 15 years of international experience spanning the UN system, academia, government, and NGOs. She brings a robust skill set in integrated systems thinking and interdisciplinary collaboration, working at the nexus of environmental health, sustainability, and health system strengthening. Based at the WHO European Centre for Environment and Health in Bonn, Mareike supports countries in advancing low-carbon, climate-resilient, and sustainable health systems. She also leads evidence reviews on mitigating the mental health impacts of climate change and fostering community resilience. Welcome, Mareike. Mareike, I think your mic is on mute. Aha.
Thank you so much for the introduction and for having me here. It's a pleasure to be part of this all-women's policy panel. Thank you.
Exactly. I'm so happy that you noticed. And I just want to say this is really great also to have such an amazing brain power and experience in this virtual room. I am really excited to start this conversation. So let's begin. Let's begin this discussion. So what I'm going to do is I'm going to ask each one of you about 2 questions. I think I was going to ask you guys all a common question at the end, but perhaps just to make sure that we have a bit of time for the Q&A, I may not do that, so we'll see. But we're going to start now with Maria Libura from the University of Warmia and Mazzoni in Olsen. Maria, let's talk about floods, because NISA hospitals experience with 2 major floods in 1997 and 2024. I understand in one in 1997, it was the Millennium Flood, called the Millennium Flood, as it was considered so exceptional, exceptionally disastrous, of course. And probably thinking that, something like that, so devastating, wasn't going to happen again. And then again, of course, hit by another flood in 2024. And it was a large flood that also heavily impacted the town and surroundings. Now, if you have to think about back to the 1997 flood and the years that followed, were there any policies, anything that was done, actions that were introduced to help reduce the impact of such events on the hospital and other healthcare facilities in that region? And how effective were those measures?
Thank you for this question. Indeed, it's a big issue because, in fact, the second flood was even more disastrous to the hospital than the first one. And one might think why, despite the initial plans, the hospital wasn't relocated. But even worse than that, some critical equipment, including diagnostic labs and imaging equipment, were still kept on the ground floor. So the part that was most likely to be flooded and affected if anything should happen. So why it happened, and I think it's not a single factor issue, but one is that there is wrong division of labor when it comes to what officials think who's responsible for protecting the infrastructure. So a lot of work had been done to protect the entire area, but it was mostly focused on flood control measures, such as building new reservoir system, strengthening the dams, diversion canals, and so on and so forth. So a lot of funding was directed to strengthen the big flood control infrastructure. And that might have given even a kind of false security sense to the hospital administration that they are indeed actually safe, because so much money has been poured into stopping the next, the next flooding from occurring. And so I think that that's the major issue, that we don't still recognize that every single sector is responsible for climate change resilience. So we think, okay, someone else from outside the healthcare system is responsible for that. It's not us. They are doing their work. They are doing it well. See the new dams. And in fact, they kept some of the impact. So just nobody expected it could be so big in the future. So that's one thing. And the second is that if something is, if you look at the name, if something is called the Millennium Flood, and you stick to the old commonsensical assumptions that such things happen very rarely, you will not prepare for another disaster of this scale happening so soon. And that shows that we need a common sense when it comes to climate change. We need to switch the common understanding of not just the experts in climate change or special committees on healthcare resilience. In fact, every single healthcare worker, I think, should understand climate change. It should be part of the curricula. Public health is, I think, a subject that is included in the medical training of all medical professionals. And there is little, I think, weight still attached to the practical impact of climate change, and that it actually is disastrous in so many ways, and it's going to impact the way those people are going to work in the future. And it's very likely to affect the work personally. It's not an abstract issue as some people think. So even the name Millennium Flood, I think, actually lessened the pressure on officials and even local administration to relocate the hospital. Now it is going to be relocated, and hopefully it will. But it took a second major flooding event to achieve that. So it's a crisis of imagination, I would say, and a wrong division of labour plus compartmentalization of responsibility. So we don't think that healthcare is responsible for protecting the physical infrastructure, that it's someone else.
That is critical, isn't it? I am really interested in what you just said, because we have been talking about how other sectors should be involved too, and where are the most high value interventions? Should they be inside the healthcare sector? Should they be outside? And I can see how, by potentially just focusing on the outside of the healthcare sector, then that created a bit of a weakness as well. And in doing that, though, the health sector has to work with other sectors, I guess, right? How then can healthcare systems strengthen their climate resilience by forming such partnerships with other sectors? Have you seen that in action, particularly after this latest flood?
Yes, I think now it's changing, and sometimes, learning comes by those difficult experiences or catastrophic experiences, as in this case. So this is changing, but I think there is still a long way to go, and the main reason is that I think it's not just Poland, that everywhere local and central governments tend to build those silos where you have specialists in given field not cooperating with professionals from outside the realm. But in this case, I think it was so vividly shown that there needs to be cooperation, not just between general planning of next huge investment in the area, but also let me add that there was a critical lack of practiced cooperation between the military. So the military moved in very quickly to help, but then it turned out that unless the civil medical staff and the military have a kind of simulation together, just in case something happens, it is difficult for them to actually share tasks and to even organize a temporary hospital. Because, for instance, there was this question, how the National Health Fund is going to reimburse those health services that are provided by the military. So there are very strange and tricky questions that, kick in once you have a disaster. So preparedness means that the people from those different areas need to work together on a daily basis, even if for a time being they may feel it's a waste of their time. And I think this is another, big problem with the so-called common sense. Why are we sitting on this committee if nothing is going to happen tomorrow or in 2 weeks' perspective? But if you don't have this kind of cooperation, disasters are going to happen.
Such great points, Maria, and thank you so much for this intervention. I'm going to take us to Andrea now. And Andrea, through your institute, Austria is working to create a more sustainable and resilient health system, working both on mitigation and on adaptation. Could you tell us what policies have been developed in your region to improve climate resilience in healthcare? And how does that work between the national level to a more granular systems and organizations level, from the top down and the bottom up, I guess?
Thank you so much for this question. And it was really exciting also to hear from the experiences in Poland. And I second so many of these thoughts and looking forward to discuss this further. I'm really happy to give also some insights into the things that we've been implementing over the past 3 years, 3.5 years in the Austrian context. We were, first of all, we were lucky enough to have funding after the pandemic for creating a separate entity within the National Public Health Institute that focuses on climate and health. And as you said, both on the mitigation side, but also the adaptation side. And I can share a couple of thoughts on this, and then I think we can dig deeper into whatever is most interesting also for the audience. But as a general principle, we've been working on, and I will maybe focus first more on the adaptation side, because this is what my unit is more focusing on at the moment. But we have a separate unit also that focuses more on the mitigation aspect. So I'm happy also to share some insights from that team. So what is important if we want to make our health systems climate resilient? First of all, it's on the one hand about the health care system. So what we heard now in the presentation about Life Resistal. So it's important to talk about the infrastructure, the people who work in the healthcare sector. That's one. And on the other hand, what we also take into account, especially when we talk about climate resilience from a public health perspective, it's really important to take into account that it's not something that can be limited to the healthcare sector, but it's really about population health and population well-being. So for both of these dimensions, we've been developing 3 different types of instrument, let's say. At the first strategic document. So we redeveloped and updated the National Heat Health Action Plan in Austria, which covers both these dimensions. So on the one hand, it's action within the healthcare system, but it's also, of course, about the general actions at the population level, which I'm going to say more about later. And then another strategic document was the development, as you said, also in my introduction, the National Adaptation Plan for the health sector. So that's the strategic level. The second level are specific tools, really to give also the communities, the regions, but also the actors within the health system specific tools. So we've heard about examples of a specific tool from the Life Resistal project. In our case, we've been working on developing programs for climate literacy of the health professionals. So really to ensure that health professionals are being taught about climate and health. And I think maybe we have time later to go into detail about that. And another tool was really to work on vulnerability and risk assessment with the regions from a health perspective, because we know that there are a lot of actors already there that talk about, as we heard also in the previous presentation, about flood risks at the general level from the natural environment. But often health is not the focus of this work. So what we try to do with our tool, that where we work with the regions, with the climate resilience check, we try to create a vision of 2050 and what climate risks mean in that context. So we try to imagine what is life going to look like in light of climate change, and what do we want to change, and where can we set some measures, or where do we need to act to improve population health and resilience. And by that, we try to talk about climate resilience not as a separate thing, but really something that is integrated with the efforts of actors at the regional level, at the national level. And also, of course, I'm very happy to have Mareike here at the international level, because this is also really important, as we will hear later. And then the third thing that we do is we create networks among people. So we've created networks within the public administration, not only at the national level. So, for example, having the Ministry of Health work with the Ministry of Climate and the Ministry of Agriculture, but also at the regional level, because this has to go vertically and horizontally. So this is also really important. And heat is a very good example in that, because heat health action often has to happen really rapidly when a heat wave hits, because we know the prognosis can only happen 2 or 3 days or maximum a week before. And so it's important that people also have these networks at the regional level. Think about the firewoman, the fire brigades being able to knowing who to call in the public administration office, but also, for example, the social workers, the community nurses, maybe even the informal caregivers that take care of people living at home that might be affected by the heat waves. This is very difficult if you have to organize it within the scope of 2 or 3 days. So it's important that these networks exist already before a heat wave hits, for example. So these are just some insights from.
No, that's really interesting, and very much talking about the complexities of climate resilience too, and in health, and how it's interconnected to other sectors. Makes me think, of course, of health in all policies and climate in all policies in some ways too, and how we are, from an operational implementation perspective, trying to handle all the complexities that all of that brings. But you did mention the work on literacy of health professionals, and I think you have these resources that you have developed. I think it's the Green Skills for a Sustainable Future. Perhaps you can talk more about that and about the health literacy programs that you have developed. Thanks.
Yes, of course. What we basically, there are two streams here as well. In the other departments, they developed a course basically for people already working in healthcare facilities, so that they are being trained on the job, so to say, and receive some certificates to really learn more about climate and health, more focused on mitigation aspects actually. But the other area that I think sometimes receives a little bit less attention is what was mentioned before, that we need to ensure that there is also structural change in how we teach about climate and health. And that's, of course, not easy, because it's sometimes not fast. And one thing that we noticed is at the national level was that many universities or other institutes do not have people who can teach about climate and health to health professionals. So they don't feel confident. They might not feel that they have enough knowledge yet. So what we developed, train the trainer course to teach these people being in direct contact with the health professionals and teaching the health professionals. So even if you don't have yet the curriculum, you can already act as a multiplicator for these health professionals who can then adapt this or use this knowledge in practice. And in our, so that's kind of more the practical side. And that's also what is reflected in our, when we looked at the literature more broadly speaking and at international level and looking through good practice in this policy brief that we developed with the European Observatory on Health Systems and Policies. So basically, we looked into what are the dimensions of developing a climate-smart health workforce. And this is closely linked to the work of the WHO, who has talked about these dimensions before. But we tried to make it a little bit more practical in this resource that we published, and it's also available for download. And so the first level is really about workforce capacity. So you need to have sufficient workforce capacity to be able to talk about climate resilience, because we know that there are so many challenges that healthcare systems are facing. So it's increasingly difficult to introduce new subjects into the curriculum to really, have people on board for this endeavor. And in the UK, for example, they solved it by including climate and health also from a legal perspective. So they made it obligatory for medical doctors to work on these topics. In the Netherlands, they had the Green Deal, which is also a really good example on how you can act. So there are, of course, several tools that you can do at the macro level. The second is at the meso level, so the organizational capacity, so really having continuing professional development for healthcare workers and including courses on climate and health there. I think also the EU Life Resistal project is a very good example here. And then the third one is really about the capacity for information awareness and communication. So really talking also about advocacy and really have also this bottom-up, supporting also the bottom-up movement among healthcare workers and giving them also the courage and the self-confidence to talk about climate and health. And also there are already a couple of examples that we mentioned in our policy brief there.
That's amazing, Andrea. And yes, I mean, we've seen the rise of interest from healthcare professionals on this topic, from the effects that they see of climate in the health of their patients, to really an interest, of course, in terms of planet and environment and health, but beyond even human health, right? So it's amazing to see how you've developed also resources in the Austrian health system to do that. I want to bring now Kim. Kim, I want to connect this a little bit to what Andrea said, and she talked a little bit about one of the instruments being vulnerability and risk assessments, right? And I wanted to ask you about data. Really great topic. The role of data collection and analysis, such as these types of assessments. What can you tell us about the role that they play in tracking the resilience of healthcare systems and how we respond to the types of risks that we are facing, in particular in Europe in this case? Over to you, Kim.
Thanks so much, and thank you as well to Maria and Andrea for highlighting their experiences in Poland and Austria. It's been very interesting. So in general, when we think about data collection and analysis, or like research in general, of course, this is really important to kind of move from the general awareness of climate change is impacting health to a more detailed understanding of actually where, how, and to what extent healthcare systems are vulnerable or what health risks are being experienced by our populations, but also what we can do about about it, right? So whether it is be an impact from extreme heat or flooding or emerging infectious diseases, or just revealing gaps in infrastructure that we currently have or in emergency planning, I think research and data collection can all provide the information that we need there. Research can also help us with identifying high-risk populations or specific regions in Europe that may be of higher risk of specific health risks that are not relevant for other regions. It can help us assess health system capacity, track trends over time, as well as informing targeted policy. So overall, I think data collection and research in general is very essential for knowledge to develop resilient healthcare systems, and also, like Andrea just said, to inform our healthcare workforce of what kind of risks they can be expecting. Like if you are not used to having certain climate-sensitive infectious diseases affecting your population, you're not going to look for that when you're seeing a patient with certain symptoms. So it's good for understanding our general risk, preparing our healthcare systems, and preparing our healthcare workforce specifically as well.
That's really interesting, and of course something that I've heard often too, around the data that's needed, and also obviously how we use that data in order to really create real actions that will actually help us face those climate change impacts. Now, I've been, as I said, in this meeting here, many academic institutions have been here, and one thing I keep hearing is we need to cater also not just to a research question, but also really cater to how can then policymakers make decisions. So from your point of view, what do we need? What is that ideal combination that we need to be able to have a really good collaboration between the scientific academic institutions and implementing organizations and policymakers, who are ultimately the ones who are probably going to give us the budget to do this stuff, right? Over to you, Kim. So, little question.
Yeah. It's a question that I really love, and I'm very curious to hear the opinions about this from the other panelists as well. But in general, I think collaboration between academic and policy institutions and multilateral organizations is really essential to ensure that the knowledge isn't just sitting in academic journals and nothing is being done with it, but ensuring that it is actively shaping policies and health systems that are meant to protect public health, and especially in this changing climate. And I will talk a little bit about my experience working with the Lancet Countdown. So for those that are not aware of this collaboration, this is a research collaboration that develops indicators aiming to track climate change and health risks over time, as well as our mitigation and adaptation response. And in the Lancet Countdown in Europe, we work very closely with multilateral organizations as the European Environment Agency, the European Commission, the World Health Organization, to really make sure that our research findings are not just rigorous, but that they are also relevant and actionable for policy making. And more in general, when I think about the connection between research and policy and like multilateral institutions, I think it's important that we have regular dialogue and engagement to make sure that evidence is discussed and refined based on policymakers' input, but also that we kind of have a co-production of knowledge, and that it's not just scientists with here you have a lot of data, but that's a two-way exchange where policy can help shape research questions, as well as scientific insights can help inform policy options. One thing that I really like that the World Health Organization is doing, for example, is that they are currently setting up a new research agenda on action on climate and health. And they're having a range of different consultations with not only academics, but also with policymakers, with people from different non-governmental organizations. And that is helping to inform a research agenda that is actionable for the whole range of policymakers. I also think that we need to make sure that the communication about the scientific data is transparent and accessible, because sometimes it can be a bit complex the way that we present scientific data, and therefore we need to find ways to translate it not only for policy audience but also for general audience. So things that we have been doing in the Lancet Countdown is developing easy infographics or policy briefs or data sheets or interactive visualizations, and for a lot of those we work directly with populations or with groups on the ground that have a much more better understanding of the local context. And then the last thing that is I think that can be very impactful is also making sure that we align our research outputs with policy cycles. So, for example, what the Lancet Countdown globally is doing is that our global report gets published close to the Conference of the Parties, which is every year where the major climate governance decisions are being made, with the hope that can input somewhat in the negotiations. So I think that is just a general way of saying I think it's really, really important that throughout the research cycle we engage with policy institutions and multilateral organizations.
And shameless plug here, the Lancet Countdown report will come out at the end of next month. Is that correct? Yes.
Yes.
Yes, and there will be, I believe, there will be quite a few events around it and ways in which scientists can also translate those findings to actual actions. So really excited that that always comes out around October, and it's a very nice way to also, for all of us in the implementing space, in the policy space, to understand what is the state of the indicators and what should we be advocating for more specifically. Thank you so much, Kim. I'm gonna now go to Mareike. Mareike, we're going to now go WHO region, the European region. Now we have, WHO has produced so many resources, right? Great resources, tools for national governments. And many countries in the WHO European region still don't have a national climate resilience strategy or adaptation plan for the health sector. What are the top reasons? Why are we still seeing this? Or are we in the right track and really progressing on time?
Thank you very much for that question, Diana. Well, this is a true observation. I think we also really need to see what's happening at the global, at the regional, and at the local level. And then another component is, I think Maria said it at the beginning, resilience, whose responsibility is it, right? I think there's also a lot of action happening actually in other sectors, which are managing the social determinants of health, which influence the health outcomes of climate-related events, but that are outside the health sector. So there might be some relevant resilience strategies embedded in buildings, in energy, or in pharmaceutical. But now, starting briefly from the various levels and angles that we see globally, it's really important to say that at the 77th World Health Assembly last year, member states adopted a landmark resolution recognizing climate change as a major threat to global health and committing to urgent coordinated action. This especially also calls to member states to develop and strengthen climate resilient and environmentally sustainable health systems. And this resolution is supported by a WHO Global Action Plan on Climate Change and Health, as well as also the very important work done by WHO, the Alliance for Transformative Action on Climate and Health, as an important platform. And then at the regional level, member states of the WHO region adopted the Budapest Declaration at the 7th Ministerial Conference on Environment Health in 2023. And this declaration also is supported by a roadmap and marks really a pivotal commitment to building climate resilient and environmentally sustainable health systems. There are various topics that are brought up, for example, heat, wash, health literacy, which was also highlighted by Andrea. There's also disaster risk reduction, early warnings, as well as obviously development of health national adaptation plans. So I think that these regional and also the global framework show that there's a very high level of commitment of governments, and we hope that this will translate into the development of further national policies. And then at the other level, there's also what you mentioned, Diana, earlier, healthcare workforce, that health professionals are also increasingly asking for things to be implemented, which brings me to the local level, still staying at the government level. But I just returned from 2 excellent meetings in Brussels, and one was the annual meeting of the WHO Regions for Health Network Conference, co-organized by WHO with the government of Flanders, who was hosting the event. And this year, the conference was on climate action. So we had various sessions where local governments and many other stakeholders actually really actively discussed about how to make the health care sector and health systems more climate resilient, but also sustainable. And for example, we had really interesting discussions on return on investment of climate action in hospital buildings, really tricky questions. Was a lot of food for thought. And at the same time, we also had a meeting of the EHP Partnership on Health Sector Climate Action. That's actually one of the tools that is supporting the implementation of the Budapest Declaration. Austria is also one of the members. We had a lot of discussions of what's happening at the national level, but there's always trickling also down then to the local level, because we have very different health sector governance systems. And there's, for example, the Netherlands, was what you mentioned before, where the Green Deal actually started as a bottom-up approach. So it's more hospitals that are driving this agenda. And I think this is probably also something you see with the Life versus Health project or with your work as Healthcare Without Harm, that a lot of action is actually really happening at that local level, and that we have hospitals who are leading this important work. Having said that, yes, more needs to happen, and we really need to make that shift from more reactive mode when a heat wave hits to strategic planning. And to come back to your original question with the limited resources and competing priorities, I mean, it is somehow both, and I think we really need to take into consideration that the health sector is under enormous stress. There's and competing interests. And we really need to integrate climate action into general health system strengthening. For example, we also need to build capacities to increase awareness. That was already mentioned by several speakers, so I don't want to dive too much into that. But important probably to realize that we need that kind of integrated thinking, how we can integrate climate action into the various departments of health sectors such as IPC or WASH, etc., buildings, in order to make the sector more climate resilient. And we also need to create that kind of cultural shift. And just to conclude, I think sharing good practices as we are doing here with this webinar, and as you're also doing through the Life versus Health project, tools and good practice examples, is really an important facilitator to build on this momentum.
No, that's really good and interesting, right? I mean, again, every region has this challenge. Globally, of course, we do too, but every system is different, and every single system will work in a different way. With the GGHH network, of course, and at a hospital bottom-up kind of level, we've seen and we've learned a lot from those hospitals and what can happen in a one system environment, perhaps, or one facility environment, and how perhaps that could be also scaled up. They have been kind of our experiment in a way to see how those actions actually are working or not. One last question for you, Mareike. We in that context of learning, right? We have seen that there has been an advance, a progress in Western Europe, perhaps, or in EU kind of legislation, the UK, of course. Do you see kind of now an interest and level of development also in terms of this field in Eastern Europe? And do you have any insight into that?
Thank you. Yeah, first of all, I think it's really wonderful to see the commitment of the UK and from other countries who are doing so much in this field. And again, I mentioned earlier the partnership, which currently has 12 members countries, and there is also an increasing interest to join. I think those networks are really crucial to exchange experience with each other, to have a regional peer learning network with very open discussions, and where we also get a lot of interest or questions asked from other countries. So what's happening? What are good practice examples in the region, right? And this is a very difficult question actually to answer, because we have different health governance systems, we have different capacities and resources, also political will and various other factors. So when we talk about the region as such, it's really important to remember we have 53 member countries, so it's a huge, it's a diversity with very diverse health sectors and with different speeds when it comes to transitioning to climate resilient and environmentally sustainable health systems. But what we see is really an increasing interest from various countries and at various levels on how to work on that topic. And I would like to just mention a few examples, and not all of them are linked to more the eastern part of Central Asia. But for instance, in May this year, there was the 11th meeting of the WHO Small Countries Initiative, a network of 12 countries with under 2 million populations, which took place this year in Slovenia. And there was a dedicated discussion on health sector decarbonization, looking at the specific context and needs of those countries, but also looking at the co-benefits from climate resilience. And Slovenia has been particularly showing a high-level political commitment to transition the health sector towards more climate resilience and sustainability. And actually, the Minister of Health will also speak on this topic during the third hearing of the Pan-European Commission on Climate and Health next week, which is on mobilizing power, building political will for a healthy climate future. So we see that political will and interest emerging. We also just had discussions with several countries from Central Asia who've been asking for technical support in building climate resilient and environmentally sustainable health systems, with a particular interest in how to bring health more closely into the NDC3 reports, but also in developing heat health action plans. And this is maybe just as a last point. As you might be aware, our water and climate team is currently working on updating the heat health guidance, which is also for the health sector. And the team has also been working with other countries over the past years, including countries from Central Asia, such as Tajikistan and Turkmenistan, to develop the heat health action guidance. So again, there's a lot happening, right? There's a lot happening at various levels. It's not always that clear, but we see that there's an interest, there's increasing action at various levels. And I think what's really important is to kind of keep that momentum, to keep building this political will, and by supporting that with very practical, tangible examples and tools. Thank you.
That's really, really great. And it really kind of comes back to this last question that I want to throw to all of you that came out through the Q&A, the chat. And it's about how do we make this a priority for governments? I think some of you have talked about making sure that there's awareness, making sure that there are health professionals who are well trained around this topic. We've been talking about partnerships, and we've been talking about how academic institutions can work with policymakers. One sentence, each one of you. What will make the difference to make sure that this is a priority, that healthcare climate resilience is a priority for governments? Let's start with Andrea.
Thank you. One sentence is very short, but I will manage with a lot of, funding, I think, is the key issue here. And it's cross-sectoral funding, really. So with a vision in mind of a well-being society, or whatever you may call it, that includes climate resilience as an integrative element, but that forces sectors to work together to access this kind of funding.
That's excellent. Thank you. Maria.
So to add on
Yeah.
The previous remark, I would say that climate policy need to be reconciled with social determinants of health, because at present it's very often socially challenged by many groups, because those at risk of socioeconomic exclusion are too often paid an extra price for climate policy. And I think this is going to be the biggest challenge in the years to come.
Thank
how
you,
to
Maria.
not make the poor pay the most for climate friendly
And this is
policies.
something that we see worldwide, exactly. Those who are often the most vulnerable are often the ones who have the more to lose, of course, and not necessarily the strongest voices. How about Kim?
One sentence is very short, fully agreeing with both Andreas and Maria's point as well. But I think one other thing I would say is trying to make sure that we stop seeing climate change as a separate issue that is separate from all the other issues that we're experiencing in the world, but recognizing that it is a risk multiplier that makes many other health crises as well as general crises as food insecurity, wars. So we really need to integrate it in our general political agenda.
Excellent. Thank you. Mareike, you're the last one. Last word, sentence.
It's wonderful. And I think that links to all the comments of the three previous speakers, especially integrated thinking. I think we really need to communicate very well the co-benefits of climate action for various aspects, for quality of care, and especially when we talk to healthcare professionals, for health prevention and disease promotion, when we talk about the costs. So making co-benefits as well as the cost of action and inaction visible in order to move the needle.
That's excellent. Thank you so much to the four of you. I've learned much from you, and I'm sure that our attendees have too. If you in the attendee chat have a question, please drop it now so that we can address it by writing, and we'll connect obviously with these wonderful panelists. Thank you so much for your time. And over to you, Gabri. Or maybe I will wrap it up then. I just wanted to thank you again for sharing not only your work and your experience, but sorry, I think I was taken out. And as we leave this webinar with new tools and fresh ideas and renewed energy, I want to extend a warm invitation for you to take this momentum forward by joining us at the 7th European Healthcare Climate Summit, which will happen online on 9 October from 1400 to 1630 minutes in in Central European time. Why should you join? We'll deepen what we started learning here today. The summit will build on the learnings from Live Resistal, also Mount Adapt, bringing in more case studies, more voices from across Europe, and more concrete pathways for action. We will focus both on mitigation and adaptation. We'll explore how healthcare institutions can reduce their carbon footprint and become more resilient to floods, heat waves, and wildfires. It is possible. And these are challenges that are affecting everyone. Some more than others, of course, those who are most vulnerable. But it is possible to do both. And we want to talk about that as well during this summit. We'll talk about tools, inspiration, networking. Apart from hearing from experts and policymakers, you will leave with practical steps, innovations you can replicate, and connections with peers who are facing similar challenges. And the summit will be online, so accessible, no travel is needed. And even if your schedule doesn't allow you to be live during the summit, registering ensures that you will be receiving the recording. So I definitely, I want to motivate you to do that. So I encourage you to register to the summit. Bring along your questions, your stories, your challenges. It's only by sharing that this works and that we learn more from each other. So I hope that you can make it. And finally, we'd like to ask you to please take a moment to fill out the survey about your experience with this webinar, which will appear on screen when this webinar comes to a close. It's just 3 short questions, and your feedback will help us improve the experience for future events. I want to thank you again, and I hope to see many of you at the summit. Let's keep this momentum going. Thank you.